Hey guys, so this video is going to be about my hernia surgery. So what I'll do is I'll first of all break down, what a hernia is, the causes or risk factors of getting a hernia, and then once you have one, what your options are, and then what recovery is like. So first of all, what a hernia is, essentially, it's just there's a weakness in your abdominal wall. And through either it could be excessive lifting, or just a one-off, like something very heavy, a lot of coughing or sneezing or, obesity, family history. These are all risk factors that can lead to a hernia. So what happens is there's a tear in the wall, and you get a little like a hole, and then you'll get a protrusion of, usually it's either fat, or as it progresses, part of your intestine. So sounds nasty. It doesn't really look all that bad, depending on how big it is. So there's risk factors. There's not like a cause. Like if you Google the causes of hernia, they're pretty much consistent across the board of all those things that I listed. I personally think it's more to do with genetics and just the way your body is made up. When I talk to the surgeons and I talk to the specialists, they all pretty much said the same thing. If you're meant to get a hernia based on your anatomical makeup or genetics or just the way your body's put together, you're more than likely going to get one eventually, whether you're young or old. If you work out, if you go to the gym, I've been going to the gym for over 10 years, you're probably going to get one at a younger age because you're just always lifting weights. If you are pretty sedentary but you're meant to get one, you'll probably get one in your 50s, 60s, 70s, just through wear and tear over your life. So it's not so much to do with an age thing. It's not so much even to do with lifestyle factors as people think that's what the causes are. It's more to do, I think, with just if you're susceptible based on how your body's made up. It's not even to do with core weakness. It has nothing to do with core strength. When you look at some guys on YouTube who have gotten hernias, Chris Bumstead, Greg Doucette, Jeff Cavalier, all these fitness guys, they're ripped, right? They have tons of core strength. Jeff Cavalier's had bilateral inguinal hernias. If your body's made up to get one, you're probably going to get one at some point, unless you're very careful and maybe aren't that active. You might not get one till a lot later on in your life. My dad had one. My grandfather had one. They were a lot older than, my grandfather was almost 80. My dad was almost 60. I was 30, but again, I've been working out for over 10 years. I was probably going to get one eventually if there's a family history of it. So pretty easy to diagnose. I had mine beginning of February. Mine was an inguinal hernia, so you can get them in, anywhere in your abdominal wall. You can get the umbilical hernia, which is around the belly button, the epigastric, which is a little bit higher, inguinal, which is in the groin, and then your femoral hernias, which are more common in women, which is on the upper part of your thigh. That's the one that you really want to get checked out quickly, because those are the ones that are far more likely to get strangulated. So there's that piece of abdominal contents actually gets stuck in the hole, cuts off blood supply, and then can lead to death of that piece of tissue. So those are the ones you want to get to the hospital right away. But the other ones, not so much. It used to be, you had a hernia, get it repaired right away. It's not that serious nowadays because they did studies, and there's less than 1% chance that you're going to get that strangulation, and the risk of surgery is less than 1%. So it's pretty much the same. So you can either do the watchful waiting or get the surgery, but it's more of an elective surgery nowadays, even though you're probably going to need to get surgery at some point, because it is a progressive injury, if you want to call it that. So for me, I had mine beginning of February. There was no pain associated with it. A lot of guys, when they get their hernias, it's not like you're doing a lift and you feel something pop. It's, I think, a common misconception. You could get that, but more than likely, you just kind of notice it. You're in the shower, you notice a bit of a lump. So there was no pain associated with it. I just saw it. I knew what it was right away. Like I said, my dad went through it. So I kind of already knew. I knew the area. It was in the groin, little lump. It was a hernia. So I went to the doctor the next day, and then it was on a Sunday, so I went to a walk-in clinic. And then I saw my family doctor the following day. Both doctors actually couldn't feel the hernia. And I think part of that was one, it was really small because I went right away. And two, when they check hernias, you're lying on your back and you're coughing. When you lie on your back, gravity kind of pulls everything down. Hernias you can't see them when you're lying on your back. So you need a very forceful cough to be able to feel it. So it's not a great test, in my opinion, to see if you have a hernia. I think you should do it more when you're standing up. So they couldn't feel it, but he sent me for an ultrasound. The ultrasound picked it up, and then I kind of went from there. So you can do the watchful waiting. That's your one option if you have a hernia, or get the surgery. Again, the watchful waiting, it wasn't really good for me because I'm young, I'm active. There was no point of waiting around. It was going to get worse. It was going to interfere with my lifestyle. I mean, if I'm older, I wasn't that active, it wasn't bothering me, you might just leave it, but if you're young and active, you don't want to have to live with this thing for decades. There's no point. It's a 40-minute procedure, get it done and then move on. So I wanted to get the surgery. When you get the surgery, there's two ways that they will repair the hernia, either with a mesh or non-mesh. A mesh is pretty much the conventional way of repairing a hernia. That's how they're going to repair it if you go to your local hospital. And it's essentially just a piece of mesh. It's a rectangular piece of, looks like fishnet. There's a hole, and it's like a patch. They'll put the mesh there and block it. Pretty simple, takes 30 minutes to do. General surgeon does it. It's an out day, or same day procedure. You go home. It's really common. There's like 1 million of these procedures done every year in the States. So that was one of the options. You can also do it laparoscopically with the mesh, but I did a lot of research. It's a very hot debate, I gotta say, with the hernias versus mesh and non-mesh. Which one's better? Because they contradict each other. You have some articles that say the mesh is better, less reoccurrence. Other articles say no, non-mesh is better. Non-mesh is definitely the older technique. It's been around since the Second World War. The mesh came into effect more in the 60s and 70s, and laparoscopically more in the 90s. But like I said, laparoscopically they still use the mesh. It's hard to find a surgeon who can do the surgery because it's a specialty surgery. You need to find someone who's obviously an expert in that area. And also with the laparoscopic, they're creating holes, right? So they're going in and they're fixing a hole, but with the ports and the holes that they're puncturing your abdominal cavity, so they can create what is called an incisional hernia. So they're now making other weak spots to fix a weak spot. So after the hernia surgery, people can develop hernias on the incisions that they went through with, just the machine essentially. So I didn't want to have to go through the laparoscopic. I know, people say that it's less pain and recovery, so quicker recovery because there's not that open incision. But there's been known to have higher reoccurrence rates with the laparoscopic. So I wasn't interested in laparoscopic. I was going to go with the open technique. It was a matter of I was getting mesh at the local hospital or non-mesh. I didn't want to get the mesh. It's, they say it's lower reoccurrence. It's, more of a rock solid, as they say, operation. But there's been a lot of complications with the mesh and around chronic pain, and just like infection. Over time the mesh degrades and shrinks and hardens. You get nerve entrapment, and people get the mesh removed and then they still have the pain. Just a lot of complications. There's been a lot of suing with the mesh companies and all this stuff. So I'm sure they're great. I know in the last few years there's been an improvement in that area, but I didn't want to have to go down the whole mesh route. So that left me with non-mesh, and it's harder to find a surgeon that will do non-mesh. You probably won't find them, I don't think anyway, in the local hospitals. You have to go to a specialty hospital. So fortunately, living here in Ontario, we have one in our backyard. So Shouldice Hospital, which is 30 minutes north of Toronto in Thornhill, Ontario. It's called Shouldice Hospital. They only do hernia repairs, and it's 98% non-mesh. So the Shouldice method, as they call it, there's I think 4 different methods for non-mesh. Shouldice is considered the gold standard. It's been around since the mid-40s. And like I said, that hospital has been there since 1945 or something like that. And that's all they do there, just hernia repairs. They don't use the mesh, which I liked. The surgeons do about 600 of these operations a year. General surgeons for the mesh only do about 20 to 50 a year. So I was going to a place where they weren't going to put any foreign material in my body. They do this operation like over 10 times more than a general surgeon would in a year. And it's routine for these guys, right? And I'm all for, honestly, going to a semi-private or, a private hospital. I just think it's a lot better. I won't get too involved in that, or talk too much about that, but I'm not a huge fan of our hospital system here in Canada. I frankly think they're, in a lot of ways just so behind the hospitals in the States. So I don't really want to go through our whole public health system. I think the communication is poor. It's slow. Like, it would take 6 months or more to get the operation here in Canada. It's just inefficient. I didn't want to have to go through the whole hospital system here in Canada. So Shouldice, I was able to get in 6 weeks after being sent there. But it was supposed to be I got diagnosed beginning of February, supposed to have the surgery middle of March. COVID happened, hospital shut down 2 days before I was supposed to go in, so it was delayed a few months. So I just had the surgery June 23rd, so about 2.5 weeks ago. So it's quicker to get in. It's a specialty hospital. They don't use mesh. My dad went there. My grandfather went there. It was an easy decision for me. Even the way they do things there, like I said, it's at a local hospital. You go home the same day. You're prescribed pain medications, whatever. I know, I was going to go home. I was going to lay on the couch, pop pain meds. It was going to be a crappy recovery. I mean, you YouTube these people recovering from hernia surgery, and it's like they just got stabbed, which, I mean, I guess you kind of did. But, I mean, it kind of turns you off to the whole idea of getting surgery. I mean, they're laying in the recliner with, like, these patches or, like, the gauze in their stomach, and they're like, oh, I can't move. It's like, oh, it's so, I can't, I'm in a whole lot of pain, and I'm like, I don't want to have to deal with any of that stuff. Where I went, you get admitted the day before surgery, you have your surgery, and then 3 days later, you get discharged. And they make you get up. You're walking. It's the day of surgery. Like, after your surgery, you have to lie in bed for 4 hours. They get you up. I was walking that same night. They used a local anesthetic with IV sedation, so you're kind of in that twilight sleep. It's not a general anesthetic. So, I didn't feel any pain during it. I felt some pulling and tugging here and there, but like I said, you're kind of in and out of it. Like, you don't really know what's going on, even though you can hear. But it was a 45-minute procedure. It felt like 5 minutes, and then that was it. I actually got up off the operating table, which I never have done before. You usually wake up in a recovery room, walk over to a wheelchair, they bring you to your room. Like I said, you got to lie in bed for 4 hours, and then the nurses get you up, and then if they, deem you safe for walking, you can walk around. So that's what I did that same night. Felt good. In terms of pain meds, I only took Tylenol, and I took Toradol, which is like a heavier anti-inflammatory. And I took those two together until I left the hospital, so about 3 days. And then when I went home, I just took Tylenol for like 2 or 3 more days. And then by the 1 week mark after surgery, I was off pain meds entirely. So I never took any like narcotics or anything like that. I could manage the pain with, just very over-the-counter stuff. So it wasn't that bad. The other thing too, they don't use any staples or stitches. They use like these little metal clips. You could probably just Google them, like Shouldice clips, and they're essentially like little metal clips that look like clothespins essentially. So they just they pinch your skin, but they don't actually go into your skin. So they just kind of pinch, and they just go along the incision. The day after surgery, the surgeon will come in, take out every other clip, and the day after that, so 48 hours after surgery, they'll take out the rest, so you have nothing holding you together, essentially, when you leave that hospital in just a few days. So it's kind of nice, because you don't feel like you're going to pop anything, or you don't feel as tight type of thing. So yeah, that was pretty much my experience. Like I said, go to your doctor right away, get diagnosed, get referred, and you can go the hospital route. You can go to Shouldice, whatever you decide. I know for Shouldice, you don't even need a referral technically. You can go there with no referral, no appointment. They just have a walk-in clinic, and the surgeon there will test you out, and then they'll say whether you need surgery or not. But because they're in Toronto, I didn't want to have to drive all the way down there, you know what I mean, and go through the walk-in clinic. So I went to my family doctor. He sent over a referral. And then you just fill out a medical questionnaire online, and then that's it. They book the surgery. So they haven't even seen you yet, and that's why you go the day before surgery, so you can meet the surgeon, and then they can check you out, because they might find other hernias during their exam, or they might say that you don't even need the repair in the first place. But so it's a little bit different system than your typical get referred to a specialist, get the consult, get the surgery. It's more, if you go there, they'll tell you right away, or your doctor can write a note saying that the hernia was found, and then you can go there and they'll check you out. And the other good thing about the Schuldeis, the surgeons there, was that when they go in there and repair, they look for other weak spots and repair those as well. So because there can be other weak spots that haven't developed into a hernia yet. Trying to think if I missed anything. When I had the hernia, like I said, I didn't have any pain. I mean, gyms were closed anyway, so I didn't really test it out a whole lot, but I was going for runs. I was doing home workouts. I didn't have any issues. I just kind of modified my exercises. It was more annoying than anything, because it was just, I knew it was there. I had in the morning some achiness along my hip, and then you kind of feel that hernia kind of work its way out, and it's just uncomfortable, but not pain. Like, I never took pain meds for it. Yeah, and then once the surgery was done, I'm 2.5 weeks out. I feel good. Gyms are still closed, so like I said, I haven't been able to do much. But I have a 20-pound dumbbell here, so I used that today. Felt good. I can pretty much do everything now without any pain. There's no hard restrictions. Typically, there's 6 to 8 weeks, nothing more than 25 pounds. There's no weight restriction. They say no more than a third of your body weight for 4 to 5 weeks, but it's not to damage the repair. Like, they assure you're not going to blow out the repair. It's rock solid. It's more just to do with pain. So use pain as your measure. But I've been, like I said, at the 1 week mark, I was off pain meds. It took probably about 10 days where I can move comfortably with everything. Like, walking was never too bad, it wasn't that bad, but the hardest thing was moving in bed, like rolling, getting out of bed, like doing that sit up, you know what I mean? You don't realize how much you use your core until they kind of cut through those layers. But it took, by about day 10, I was able to get out of bed normally with no issues. Like I said, I'm like 16, 17 days now, and I don't have any issues with my movements. I can get in and out of a car, no problem. Like I said, lifting, 20-pound dumbbells, that's all I have here. It's not an issue. I can do a squat without feeling restricted or tight. So all in all, pretty good. And yeah, that's pretty much it. So he assured me, like, the actual operation, it's like a 99% lifetime, like 1% chance that you'll blow through it again. But it's, like I said, they use your obliques and your TA muscles. They use 4 layers and just sew them together. So it's going to be nearly impossible to wreck it. I'm more worried about the other side because I asked him, I said, what are the chances of me blowing out the left side? And the odds aren't great. I mean, he said it's usually a 50% chance that the other side goes within 1 to 3 years. So there's some other guys I was talking to in the hospital, and a lot of them were in there for the other side. And, they had it done 20 years ago, and now the other side went. And so, like I said, it's just kind of way your body's made up. So I know I'm at high risk of the other side going. I wouldn't be surprised at all if I get a hernia on the other side in the next couple years, because I know guys who have gone to the gym, had the repair done, and a year later, the other side went. So I just got to be careful. I'm probably going to change up my exercises. Like, for me, I'm 31 now, so, I'm not 21, 22 anymore, where I was going to go for PRs and, lift really heavy. Like, I don't need to be doing heavy stuff anymore. So I'm probably going to change up my workouts anyway, and just put myself at a reduced risk of getting them. Because obviously the heavy squats, the deadlifts, those type of exercises, are going to put you at higher risk than doing a seated, shoulder press or preacher curl or even leg press. You're at less likelihood of doing it. So I don't want to have to, if I have to get it done again, I will. But Obviously, I just rather be safe in the gym because, for someone who likes to work out, getting a hernia sucks. Not so much in terms of pain or anything like that, because like I said, it's not, but it's just annoying because it's not like your typical injury where you're doing something stupid and you're, you see it on YouTube, guys lifting like 400-pound curls and they blow out their biceps, and it's like, then they get the bicep repaired, and it's like, okay, well, if you don't want that to happen again, don't be an idiot in the gym. It's one of those things where the hernia happens at any time. Don't have to be lifting heavy, and once you get it, you got to get the surgery. So it's kind of it messes with you mentally more than physically, to be honest with you, because it's just, you're like, I feel like I'm doing all the right things, and then I'm getting injured. So hopefully not. Hopefully I don't have to go through it again. But like I said, it's not that bad. My recommendation, if you get it, go to Schuldeis. I think that's the best way to go. Those guys just have it down to a science. And I'd rather go there than, like I said, to our local hospitals. So yeah, that's pretty much my story. Like I said, the important thing is get it done as quickly as you can, because it's not going to get better. And there's guys on YouTube that I've come across that claim that they can heal their hernia naturally with exercises and this kind of stuff. I don't know what they're talking about. You can't. I mean, they're claiming they're doing these cremaster muscle lifts and stomach vacuums, and they can reduce their hernia. Like, you might be able to like manage your symptoms, but you're not going to be able to get rid of your hernia by doing exercises or not getting it fixed surgically, unfortunately. So yeah, and even if you could, I wouldn't want to waste years doing these crazy exercises when I could just get it done in 40 minutes. So yeah, that's my experience with it. If you have any questions, just leave them in the comments. But this video is long, and I probably answered most questions. All right, until next time, see ya.